with all due respect.
Hey, we're Josh Ortegon and Greg Gaines, and this is With All Due Respect, the show where we keep it real about health, fitness, and performance. From weight loss to sports development, we're covering the conversations that matter.
Follow us on Instagram at Phenom Fitness, PHNM Fitness, and visit www.phenomfit.com to check out our training programs, coaching, and gear built for real results. Let's get into it.
All right, with all due respect, 87. Guys, I missed 86. It was the first time Gray did a podcast by herself, I think.
Mm-hmm. Yeah, I missed you.
I had a migraine for the first time in my life. I didn't know what it was, but I was in complete panic with a migraine. I've had a lot of eye study. It sounds like I have one eye's wrong, one eye's good, one eye's bad, astigmatism, all this kind of stuff. And then it hit me in one day with a migraine, which I have complete empathy now for people, anybody I've ever made fun of for a migraine. Sorry. It is 100% legit where it shut down my day, right? Mm-hmm. But today, guys, I feel like we're beating the dead horse with sleep. Don't you feel like that sometimes, Gray, when we
but we have to because people don't get it.
Yes. And you know, the greatest thing we've ever heard was the sleep is the number one performance enhancement drug that nobody uses. Mm-hmm. And today we're with Meredith Broderick. The SoundSleep Guru is her practice name. And when Grace sent me this and we're talking about reaching out to people and I saw SoundSleep Guru, I'm like, I'm on it, right? I'm on sleep. And this is a subject where I think people are going to see this topic and be like, my sleep's fine. Oh, I do that. Oh, I do that. My sleep's good. I'm good. I'm not really, I just get a little tired during the day and, oh, I'm fine. And I was that person until I started monitoring sleep. And then I realized my sleep was horrible. I was missing so much out on just not really performance, but just my quality of life was affected. So now when we work with clients, Meredith, sleep is like one of the first things we talk about. And I hope if you're watching this, you just don't hit stop and be like, oh, I saw the Joe Rogan sleep episode and oh, I do this, or I'm on a CPAP and I'm good, or this. I hope you pay attention to the things we're going to talk about today, because Meredith, so far, even the pre-conversation we had, we're going to talk about some subjects I don't think people talk about a lot with sleep. So Meredith, if you would, please introduce yourself. I'm a horrible introducer of people. I just threw it on people to introduce yourself. Introduce yourself, who your practice is, where you're at, what got you into sleep. And then we'll just start a conversation around sleep, but I'd love for you to set the stage with who you are and what you do.
Thank you so much for having me. I am a triple board certified sleep neurologist. I have a boutique practice in the Seattle metro area, and I am one of only 4 practitioners in the world that's certified in neurology, sleep medicine, and behavioral sleep medicine. And I don't like to self-promote, but I do like to point that out because I think it offers a unique vantage point and it creates kind of a niche for me in terms of what I do, being able to get all those vantage points. And it's also one of the reasons why I got into sleep medicine. I would say there's 2 main reasons I got into sleep medicine. The first one is in my neurology training, which is my primary specialty, I saw a lot of people with brain disease, stroke, which is a vascular disease, neurodegenerative diseases. So we're talking about Alzheimer's and Parkinson's disease. And I really didn't like the feeling we couldn't do much for them after we've reached this point. The damage is done in a way. And I saw sleep as this new frontier that offered a lot of preventative strategies. It also appealed to me because I came to find out I was living with sleep disorders and I struggled a lot in my medical training with sleep deprivation. It really affected my mental health. And I thought I need to understand this better. It's something about myself I want to understand. I think a lot of people get into their work because of something they experience. So I would say those are the two things.
When did your sleep disorders start? Was it always a lifetime thing, or did you notice it more when you did go through medical school? Because you guys are obviously not sleeping very much when you're in med school.
I had it my whole life. My situation was a little bit unique because I am a transracial Korean adoptee. So I grew up in a white family, very genetically different. I am a night owl by nature. That's a genetic trait. My white family are early morning people. My mom's family were farmers. They get up at the crack of dawn. They do everything in the morning. They go golfing, they go running, they do all their chores. And I'm like the complete opposite. And I never recognized that as a sleep disorder growing up. I just sort of thought, well, I'm lazy. I'm lazy. And something is wrong with me. And I think for a lot of people that are night owls, it's sort of, I see it as like a neurodiversity type of trait. And there's the self-loathing involved when really it's a completely normal way to be or healthy way to be. It's just that culturally we sort of appreciate, being right-handed and, being an early morning person and, that sort of thing. And then there were other ways that manifested in terms of, having trouble getting up for school, being late all the time, and then just driving my mom crazy because I was like rearranging my furniture at 2 a.m.
I love that she just hears you pushing couches across the floor. So you really saw it start at a young age.
Very young, yeah.
Also very interesting. I guess I've never really thought of it in a sense of it being genetic or it being a cultural thing. Like I grew up in a very early morning house. My dad's downstairs whistling with the dog at 5:30 in the morning before everybody gets up. Like I never would have recognized that before. Very interesting point.
What have you seen? That is interesting. What does the research say around genetics, sleep, that type of stuff, and cultures?
Mhm.
Right? Not just cultures, but races. I've never even considered that a thing until you
Me
started.
neither.
I just considered every human probably should be in bed by 10, should probably be up by 6:30, and that now I have seen some stuff around like where people's sleep zones are. Like some people,
Mhm.
I took a little test that said like I'm like an 11 to 7 sleeper. I don't even know if that's legit. Like you could be like, I work in the fitness industry. I have people come to me all the time with things that are bull crap. Do that to you, and you're like, don't fall for that. Are What is the spectrum of research that's done around culture, races, sleep? Do certain cultures have um different sleep patterns, different sleep expectations, like the morning person, the night owl? I would love for you to talk more about that because I'm bicultural, biracial, Hispanic dad, and a red-haired, freckled mom, right? And I mean, my dad was super dark. Um, Grew up in a complete different culture. Grew up in Mexico City, very Mayan Indian, and a mom who looks like she came off the Mayflower from Scotland. And when I think about that, I'm like, dang, how am I affected by the cultural and genetic pass downs of sleep? Can you
Mhm.
talk about that? Because that sounds intriguing to me.
It's extremely fascinating. And there's both cultural and biological factors to consider. So if you imagine, first of all, one thing we have to acknowledge is that humans evolved to sleep at night. Not all animals sleep at night, right? And that's a behavioral adaptation to our environment. It's cold and dark and dangerous at night. And one of the reasons we sleep at night is to conserve energy because it's more expensive to produce heat. And if you think about the original humans, they evolved in Africa where there's a pretty balanced light dark cycle. And as humans started to migrate to different environments, especially far north, they got lighter skin and they needed to develop genetic changes to adapt to different light dark environments. And for that reason, I practiced in Alaska for 5 years. You'll notice people live more seasonally in those environments. They're very, very busy in the summer. They sleep a lot less. But then they sort of do this like mini hibernation in the wintertime. Whereas most people don't live that anyway. They have a 9 to 5 job. It's the same like all the time, right? And so there's those genetic changes where, depending on maybe where your ancestors were in this kind of evolutionary process, you may be more sensitive to light dark changes because you needed to adapt to the seasonality of your environment. Right. It has to do also with like vitamin D and things like that, where, if you have lighter skin, you can get vitamin D more easily. So that's like a whole nother conversation. But culture is important too, because I think in Europe, in China, in some countries, we do afternoon siesta. It's acceptable to take a nap. Some places in Europe, we have dinner at 10 o'clock. There are some tribes in Africa and South America that are studied that are hunter-gatherer tribes, and they sleep 7 hours, 7 to 7.5 hours. And so I think this is interesting because, again, going back to that neurodiversity, there's no one right way to sleep healthy. It's really about being adapted to your environment and what your demands are, right? To some degree.
Do you think one of the issues we have with trying to help people with sleep is we try to fit everybody into the one size fits all?
Exactly. And I'm sure you see that as a fitness coach, is if you look at this physique of a runner, an endurance runner versus somebody who's, a bodybuilder versus somebody who's a professional football player, you need different goals, right? And all of them are healthy. But specifically, where do we need to get you? And that's something I really think about a lot when I see my patients with all types of different health conditions, life situations, values, culture. That's what makes sleep so interesting to me.
We've always heard, going to sleep after midnight can have maybe damaging effects. It can very much affect brain activity or just your overall health. Is there truth to that?
Yes, the thing that I worry about the most is metabolic health. It makes you insulin resistant. And then also, for most people that aren't night owls, they're going to get most of their deep sleep, so that's where tissue healing and a lot of restorative processes happen. It's going to happen. And if you go to bed too late, you're just going to miss it.
Okay. So very interesting. Like that still would apply. So maybe somebody that struggles with going to bed at a decent hour before midnight, how are they going to get deep sleep? Do you encourage them to get into a routine of going to bed before midnight? Do you focus on getting them into a good quality sleep, even if it's less hours? How would you work with someone like that?
I would make a list of those things and I would ask them, which one of these seems easiest for you? A lot of times there is an order of operations where making sure someone's breathing healthy is very important to me as a physician, because breathing disorders and sleep are extremely common. I would say number 2, duration is important, regularity of schedule is important, and then quantity. So, we like to kind of build up into an order of operations. And I ask my patients, what seems the most manageable? What do you want to tackle first? But some of the things will fall in place. If you have good regularity, good, timing consistently, your quality will improve.
Right. Absolutely.
Yeah, that's tackling the one that's the easiest is really how you're going to help the most, right? I mean, the few things that I tell people that come to me and they're like, hey, I need to help my sleep, even if they're just friends of mine, I usually say routine. Don't eat 2 hours before you go to bed. And avoid screen time within an hour of going to bed. That's kind of my mantra. The screen time is really hard for people. That's the most, and that's challenging for me. Putting it all down, grabbing a book, dimming the lights, not watching the screen. I find that that is the hardest one for people just because we're culturally screen people, right? We're scrollers, we're phone people. Do you have that as one of your top? Like, is that one of the top tier ones you address? Or do you feel like, hey, let's look for things that are easier than the screen time? What do you see with the screen time?
No, I agree.
Okay.
I think that's the hardest because it's so addictive. It's so engaging. It's so mindless. I always mention it. I think you're giving good advice. And I think the devil is in the details.
Mhm.
Sometimes it takes people sort of hitting rock bottom with their sleep to make them want to mind over matter, because that's really what it's about.
Yeah. No, it's so I have a friend of mine um who actually bought I mean, somebody's gonna watch this podcast and not even realize these things exist. A plug-in alarm clock
Yep.
for,
Hmm.
for his room. And yes, there are things you can plug in that show the time that you turn the alarm on and it turns on. It's not your phone. And plugs his phone downstairs. So he literally plugs the phone in downstairs, goes upstairs, turns the alarm on, goes to bed. So that for him to get his phone, he's got to go all the way downstairs, grab his phone. And he said it made the biggest, and that was hard to do it, but it made the biggest impact. Um, you brought up something in the original conversation that I like to talk about. Brain health was really
Hmm.
what kind of got you involved in sleep. Can you talk a little bit about brain health, mood, memory, things like that, and the connection to sleep and just brain health in general?
Yes. Well, sleep is the way we restore our body, not just our brain. Even our gut needs it needs time to restore itself, turn over, to function in a healthful way. And I think it was like 2012 or someone like that. There was a discovery that there's a brainwashing system that occurs at night. It's like 25 times more active at night. And essentially what's happening is the waste products are being removed from the brain. And these waste products, if we look at people with like Parkinson's disease or Alzheimer's disease, that's what they've got. They've got a buildup of all these waste products. And if you don't clean up that waste, we're thinking these things are accumulating. So that's number one for brain health. Number two is if you want to have parasympathetic balance, meaning the rest and digest, kind of the calming effect of your day to balance out the yin of the sympathetic or the fight or flight, you have to have healthy sleep. And that's where heart health comes in, or vascular health. So when people talk about heart health, that's exactly the same for the brain, because we have blood vessels in our brain as well. So high blood pressure, high cholesterol, metabolic issues. So that's insulin resistance. Those are all significantly tied into poor sleep. If you have poor sleep or not enough sleep, high risk for high blood pressure, high risk for insulin resistant, prediabetes. All those things are very damaging to the brain health.
It's crazy. It's almost like it's all interconnected.
It is interconnected. Wouldn't you know?
Absolutely. And I know you wanted to talk about, I feel like this is a good segue, kind of talking about heart health and what people are, fitness is a great trend now. Thank God everybody's exercising. But I know you wanted to talk about when is too much, right? That's a big piece of sleep. Are we overtraining in any way? Are we putting way too much focus on our fitness that we forget about our sleep? So I'd love to hear your take on that.
I love all of the content going around women lifting, people who wouldn't necessarily do strength training and saying, look, you need to do it. I love it. I also love seeing like the HIIT and the VO2 max, because those things are all on point. But I do think there are some people that get really health obsessed. And what I would ask them is, if you're not sleeping well, to ask yourself, are you overtraining? And I don't know if people realize that you can overtrain.
Mhm.
Because you might be feeling like, oh, I'm not as fit as I want to be, so how could I be overtraining? More is not always better. And I mean, you both could speak to that probably better than I could, but I see that in my tech culture, people are just like so, they're so into it, but it sort of goes to an extreme.
Sure. And what we experience with a lot of those people, especially women that overtrain, is that they're also under eating. So then you have the perfect combination or the perfect concoction for overtrained body, underfed body, really stressed out body, poor sleeping body. You're not getting enough nutrients. So no wonder your hormones feel all over the place because they probably are in some way, right? So that's, again, all interconnected of what we're experiencing. It's like if you're sleeping poorly, there's probably a lot of other things underneath you that you could be working on in order to sleep better.
Oh, 100%. Just before I got on this call, I was reading a study about insomnia, menopause, and dietary and nutrition and how important that is.
Mm-hmm. What was that study talking about? Just like fueling correctly, fueling enough?
Yeah, it was basically talking about how symptoms of menopause and insomnia are reduced with a Mediterranean-based diet or a diet that's aimed more towards like a low blood pressure.
Mm-hmm.
Wow,
I know.
that's interesting, isn't that?
Mm-hmm.
That's interesting that that type of diet lowering blood pressure, but the effects on poor sleep or insomnia. One thing I think our culture is getting away from too, and you talked about this a little bit. We talked about the exercise. Somewhere in social media, we have been telling people that it's all about the grind,
Mhm.
right? You see people bragging about their 4:30 workout, and I'm up late at night doing this grind work because I'm on my grind for my new business. And luckily, I've never been that never been that person, right? And I've always been confused, and I kind of deflect from that content that's just so over the top, bragging about how much they don't sleep because they're just grinding out their new business and that 4:30, I'm up before everybody working and I'm this and I'm not lazy, but like I saw the holes in that content in the very beginning. Um, yes, we want to work hard, but man, I've seen people do the 4:30. I'm getting up, I'm working till midnight. I only need 4 hours of sleep. I've seen those people crash.
Me too.
I've seen
Yeah.
them kick them in the face. Um, and I think some of that is our culture is moving away from some of that. I'm seeing content of people are like, hey man, you need to chill out.
Hmm.
I especially see it too, great contact kind of connected about it a little bit. The high intensity, always going workout so hard. I'm dying. I got a puke bucket next to me. I'm so sore all the time. I'm getting my workouts in. I'm doing this. And I'm like, that's not health. Like, that's
Hmm.
not being like, we have a good friend of ours that's done a bunch of research in sleep, but he's a PA now. I remember it hitting him. We're having conversations. I said, man, if you were talking to somebody, what's the first thing you'd address in their health? And I thought we're doing like eating or more protein or exercise. He goes, get their sleep right first. And I'm like, oh, like that shocks me. Doesn't shock me
Hmm.
anymore, right?
Hmm.
Because there are people who exercise so hard, so intense, the adrenaline rush of it. They're sore all the time. Their sleep sucks. Um, they're up in the middle of the night. Even before the call, we talked about it. That's a real thing. Now, that's a
Hmm.
niche community of people. Most people need to see the sunlight, work out a little bit, do it. But I know a lot of people in the fitness community where that's become mentally unhealthy,
I think
right?
it could be like a deep rooted fear of being average. I feel like whenever I'm like turning and burning like that, it's a deeply rooted fear of being average because I don't want to exist in that space. But it's absolutely becoming a thing to now take things a lot slower. I hope it continues to be that way. I think women that were higher performing athletes, at least in my personal workspace with women, they're seeing how much good rest does for them. Even if it's like, okay, I go from 6 days of working out to five. It's like, oh my gosh, I don't have that 4 o'clock crash. Oh my gosh, like I actually lost a little bit of weight because my body is performing well. Or like, oh my gosh, I'm not waking up in the middle of the night. That's like a huge puzzle piece for a lot of people.
I would
Yeah,
love.
I mean,
No. Go ahead, please continue.
your body doesn't differentiate stress from work versus relational stress versus stressing your body. It's just stress. And so I think we just think, oh, exercise is good, but I think you have to be smart about it.
Right.
How about timing exercise around sleep? Like I hear people say this all the time. Oh, I crank out my lifts at 9 o'clock at night. Those are the same people that say that probably do their pre-workout at 7. Lift.
Yeah.
It doesn't affect me. I could drink 3 cups of coffee and go to bed 2 hours later. And is there some research around where sleep is in your body? Like, should should nobody be like lifting and doing their sprint work and their hit at 9 o'clock at night? Like, is there any research around that?
There's so much research around it, and it's really well known. If we go back to that behavioral adaptation to our environment model, what happens with our blood volume in the evening is once the sun goes down, the melatonin secretion would start. This isn't a hunter-gatherer society, so we're saying no electricity, right? It starts to signal to the body to shift the blood volume from the periphery, so from the muscles into the core. The reason we do that is to protect our heat and our energy store. I'm talking about you're sleeping outside and it's 30 degrees. You need to make sure you're not losing any heat, right? That's why your core body temperature goes down. It's like putting the thermostat at 60 when you go on vacation. Why do I need to produce that heat? I'm not going to be there, right? I'm not going to be active. I don't need to keep any heat in my limbs. So that's what you're doing. And so what happens when you exercise is you're delaying that process because you're keeping the body from starting that temperature lowering, which actually happens before we actually even fall asleep. So a lot of people are like, oh, cool down, cool down. Yeah, that's great. Yeah, you do want to, the environment would normally cool down in nature, but the reason we cool down is, it's because of this behavioral adaptation to the environment. It's not because like that puts you to sleep. It's part of the sleep wake cycle. It's part of it.
How late would be too late for a workout? Like what would be the ideal time if you go to bed, let's say at 10 o'clock? When should you be working out, or how much time do you need in between your workout and your sleep time?
Ideally, it would be 3 hours.
Okay.
The only time I tell people go ahead and work out at night is if I have this extreme early morning person and they say, gosh, I'm just like, I can barely make it till 9 o'clock and then I'm waking up early. And we actually want to use that tactic to push a little later to align their sleep schedule a bit more to where they want to start their day. Like if they feel their sleep schedule's drifting a little early, then we might use that tactic to move it.
Gotcha. It's always so interesting to me because even like, and I would love to talk about wearables in a second, but to bring up wearables, I go and join my husband at his CrossFit gym once a week at 6:15 at night. That is too late for me. I'm a 9:15 girl. I like to be in the gym at 9:15. I take a slow morning. I don't want to be at the gym after hours, but I always wake up the next day and it's like poor recovery. Like your sleep score is much lower than normal, poor recovery. So let's talk about the wearables, of course, but then also could you give us a little bit of the back of like what our muscles are doing overnight, what our brain is doing overnight, like those things that we need with the recovery and sleep?
Yeah. Our brain is very busy at night. Our
Mhm.
brain is taking care of a lot of things. It's consolidating memories, it's learning, it's balancing our mental health. So it's rehearsing experiences we've had during the day that could even be traumatic, and it's making them less traumatic. It's clearing the brain of waste products. It's balancing out, like I said, that sympathetic drive.
Right.
It's restoring and recovering. And I think we delay and we inhibit that process by working out. I think the other thing to add is if you're really trying to enhance your performance, there's an optimal time of day for performance, and it's earlier, it's in the afternoon. So if you really want to perform your best and get the most out of your workout, then again, night is not the time to use it. And I always tell people who do not sleep well, people who are sleepy during the day, and even people who say they don't sleep, they're not a good judge. It's kind of like being drunk. I'm not drunk, and like we can have people that are very sleepy that say I'm not sleepy, but you go on a 10-minute drive in the car and they fall asleep and you're like, well, you're sleepy.
Right. Like you are going to sleep right now.
Like
Yes.
if you were not sleepy, you would stay awake, right?
Right. Exactly.
But yeah, well, you hear the people that are always like, is there a little bit of fight or flight in that? Like, do you think there are people who like part of the adrenaline and the fight or flight they have to have during the day is they can't slow down and relax because if they do, I get tired. You hear people say that all the time. Oh no, I got to keep moving during the day because I'll get tired. I'll fall asleep.
100%. 100%.
That sounds like a bad cycle if you ask me. Like that cycle of fight or flight doesn't sound good.
Mm-hmm.
Even man, I keep going back to the mental health side of this.
Yes.
The effects of bad sleep and mental health. I mean, my guess is there's a large connection to depression and poor sleep, anxiety and poor sleep. Kind of like the chicken or the egg. Is it your anxiety causing bad sleep, or is your bad sleep causing anxiety? It's probably a full circle.
Correct.
Probably a full circle where if we start really addressing mental health, because I've never had a counselor or a therapist or anybody I know say, well, you should probably get some better sleep for better mental health. I've never heard a counselor. Now, I'm sure there are. Probably going to get an email from somebody that's going to say that. But the wearable side, as somebody who is extremely educated about sleep, I have a feeling the wearable side could be a positive, but also drive you crazy at the same time,
Exactly.
right? In our world, it's kind of like people that come to us and, well, I had a great workout. I burned 7,000 calories in that workout. Well, it doesn't mean it's a good workout, right? Like that doesn't like I hear people just say it like it's just like it's religion. Great workout today, coach. 700 calories I burned. I'm like, that doesn't mean nothing to me. Do you have people that come to you and say, Meredith, I don't know what's going on in my sleep. My Whoop band says I'm fully restored, but I feel horrible. Does a little bit of that drive you crazy a little bit?
I would say the number one is people come saying, it says I sleep less than I feel like I do, and my percentages of deep sleep and REM sleep are low, and I'm scared. And my mom had Alzheimer's disease, and now I'm worried. That's the number one. People get scared by the negative news, not if they're told it's good. I don't think it bothers them much.
Percent accuracy? 'Cause I don't know the accuracy on the sleep side. I know we talk a lot about, the accuracy on the calorie burn side and how they're not 100%. What's the accuracy or the research behind the wearables with sleep?
We think that the average in terms of total sleep time, so measuring the sleep duration, is close. It's not perfect if we compare to in-lab sleep testing as the gold standard. But as far as differentiating between the sleep stages, not as good. And it's all over the place. I don't know if you all have worn more than one, but I know I have, and they're just all over the place. So you're like, if I'm not getting a consistent signal, one of them is wrong, right? It tells you. And I know that for me personally, I have done sleep studies, medical grade sleep studies, and it just it's not the same as what I get. There are common scenarios that makes it worse. So if you're someone who moves a lot in your sleep, it's going to look a lot worse. There's some common themes. And I think some of them, the biggest thing with those wearables is there's like motion artifact. So I love technology. I love the potential that it has, and the idea to be able to gather data on a scale like that and provide accessibility to people is so exciting to me. I think right now, though, if we're talking about the most common wearables, we're not giving people anything back. We're just giving them information that may or may not be correct and is sometimes harmful. And there's certain people that it's harmful too. And it's probably the same folks you see. It's the ones that get a little bit overly obsessed. We even have a sleep disorder called orthosomnia to say, put your sleep tracker away because it's harming you more than it's helping.
That's something you always have to take it with a grain of salt. And that's what I remind people of when I work with them. I'm like, the calories burned on your wearable, your sleep score. I want you to make sure that you feel well. Because my watch can tell me I got a 92 on my sleep score. And later that day, if I have a 4 o'clock crash, I'm like, that probably wasn't the best sleep, right? That wasn't really 92 sleep, you know? So I always like to remind people, it's like, I like that you see your numbers. I like that you're paying attention. I like that you've made it a part of your routine to like actually work on these things, but let's not base our whole day off of the 87 that you got this morning.
Right.
I have found so I've played around with different sleep trackers. The number one thing that seems to be the most inconsistent for me is HRV.
Me too.
Mm-hmm.
My
Mhm.
HRV is all over the place. So it got to the point now that I really don't pay attention much to HRV because I just got so many different feedback on it. I look at total duration of sleep time and like my recovery time, and those are what kind of determine like, and it did change habit. Wearing a sleep tracker did make me start going to bed earlier because the earlier I went to bed, the better quality sleep I had, the better I felt. I saw a difference in I know people whose sleep tracker and they removed alcohol from their life,
Oh, yes.
right? So let's go straight into what we want to cannabis. We can go straight alcohol to cannabis. I have friends, I still have friends, I mean, I have friends across all spectrum that tell me I smoke weed so I can sleep.
Mm-hmm.
A deep sleep. Without it, I can't sleep.
Mhm.
Mm-hmm.
There's some people that say that. I just kind of nod my head. I'm like, good job, buddy. But my real friends, I'm like, hey, look into that and make sure that's really what it's doing. Or are you just getting really stoned and you zonk out and you're, what I'm saying? Like, are you justifying it? Before we went live, you said this is a topic that's interesting you right now. I would love to talk about it because we do have a large percentage of people shifting from drinking alcohol. Me and Gray talked about this last week, and they're using cannabis or CBD or other cannabinoid type things. Um, they're really just switching to alcohol to weed, is what I think. Like you're just going from one way to get you in a different environment to weed to get you in a different environment. Talk about the science behind cannabis and sleep and debunk some things that you hear and talk about things that it might benefit. I don't know, it might, but that is a subject that does interest me as well.
Mm-hmm. Well, I think the biggest problem with cannabis is it's being marketed to people in such a way that they don't see the harmful side of it. Whereas when I look at it, I see it as a very similar chemical to alcohol. It's going to sedate you, it sort of numbs you a little bit, but it's unfavorable for your sleep architecture, meaning wanting to get those beautiful sleep cycles of deep sleep and REM sleep in the right quantities and proportions. It's disturbed. It's addictive. So if you start using cannabis every night and then you want to stop it, you will have horrible, horrible rebound insomnia. I have actually seen this happened actually in a teenager where the parents found out and took it away. He had kind of a situation like mine where he was a night owl and just was trying to help himself, and he went psychotic. There's a lot of literature around people can develop, it affects their motivation, it can affect their personality. Some people get the munchies and they gain weight. And then there can also be long-term damage to the sleep wake systems in the brain where you get this narcolepsy-like syndrome. So it's very toxic. And then I think the other problem with it is because it's not a prescription, not that prescriptions are necessarily better, is you can take as much as you want. And you might not even know what you're getting, but there is this sort of, I think, marketing, and tell me if you agree, that, oh, this indica is really good for sleep, right? I used to hear, women say, I just need to come home and have 2 glasses of wine and take the edge off. right? And now I just come home and I just vape a couple puffs, and it's just a couple puffs, but I mean, I don't see it as any healthier than drinking alcohol, but I think the perception because of marketing is that it's not as bad. That's kind of what I see.
I've had 1,000 women come to me and be like, I'll be like, well, what's your alcohol intake like? Because we're just talking about fitness and calories and what they're doing. I don't drink, but about 3 or 4 nights a week, I'll just, those 2 glasses of wine just to kind of chill me out so I sleep better.
Hmm.
Research says that's not true. You do not sleep better because, and one of my mantras I say is sedative sleep is not restorative sleep.
Correct.
And what we're talking about with even the use of weed or cannabis, whatever, it's sedative. The brain, if you really probably did a sleep study and looked at the brain, they're not getting the full benefits of sleep at all, are they?
Mhm.
Correct.
So you like it, again, it's cyclical, right? Like you exist in that fight or flight because the one thing that calms you down at the end of the day is your 2 glasses of wine. Well, then you don't get good sleep, so then you automatically wake up again in fight or flight. And they just don't see the connection of all of these things. And I think that's like why we harp on it so much with our coaching. Is I'm like, if you would really just have one good night of sleep, you would find the next day that you don't need those 2 glasses of wine at night. And then you get into a good routine of it all.
Awesome.
Right.
We're in a state too where it's not legalized. Oregon's legalized. In Seattle, it's legalized, right? I mean,
Yeah, it's been
Washington.
legal for a long time here, like
Yeah.
over 10 years.
you can literally just roll in and do a distiller or where you want, order it off like a Starbucks menu.
Hmm.
Correct.
So for you as a sleep doctor, you're now battling that. Like it's you can just walk on the corner. And I bet
Hmm.
some of those places market theirs as, oh, use this strand to take the edge off at night. And you're probably like, oh
Hmm.
my gosh, like
No, I mean, that's the hard part is I would say 80% of the patients that I see are using some kind of cannabis. And the hardest part about it is trying to change the perception that it's not harmful. And it's interesting because I'm reading this book on the history of cancer, and it's hard to imagine, but in like the 1940s, people honestly didn't know that smoking was bad. They really didn't know. Like
Right.
it's hard to imagine that now because it just seems like a foregone conclusion that why would you smoke? It's so bad. I wouldn't do that because it's so bad. But that's the problem with not sleeping enough and all these sleep things and then cannabis and things is like people really don't understand how detrimental it is to their health. That is really the crux. Because if they knew,
hmm.
then we would have different motivations, right?
Yeah,
Or
what do
you
we do?
know, sleep is one of the first things we sacrifice, I feel like too. So that's, back to, I think Josh, you said this earlier, like we'll make up any excuse to make it sound like we have a healthy habit or to make it sound like whatever we're holding on to is fine with us. People are so quick to sacrifice any ounce of sleep, right? Oh, if there's a new show on, I gotta watch my show. Oh, I gotta get up for my 4:30 a.m. workout. Oh, I've just had a baby, like I have to get up with the baby in the middle of the night. Sleep is the first thing out the window, and I can tell you I'm guilty of that too, right?
Yeah,
If there's
me
a
too.
good TV show on, I'm like, well, midnight it is.
One of the last things I'd like to cover in this big, I feel in there's a lot hormone replacement for women is becoming a big subject.
Mhm.
Hmm.
One of the first places my wife wanted to see improvement through hormone replacement wasn't even weight loss, workout, it was. And I have a lot of clients who say, I haven't. First of all, you probably hear a lot of people say they have insomnia. They don't. It's kind of like calling somebody a narcissist. Oh, they're a narcissist. Well, that's not, they're just a jerk, right? Um, insomnia, I feel like is one of those things people throw out, like if they have a couple bad nights of sleep, they're like, I have insomnia. No, that's a clinical diagnosis,
Mhm.
insomnia, right? You don't have insomnia, you just drink too much caffeine, stay up too late, and your phone's. But a lot of women that go on hormone replacements, a lot of the first place they look is they're looking for sleep improvement,
Hmm.
testosterone, things like that. Can you give some education around perimenopause, hormone replacement, sleep to that um, demographic of female, or that really becomes a tough problem for them. It's real. I've had women say it a lot. Can we talk a little bit about your experience in hormone replacement, sleep, perimenopause, and what you're seeing?
Hmm. Absolutely. I think that has always been true. It's wonderful that we're seeing this. There are a lot of great, I think, creators bringing that, physician experts online, bringing that to the forefront. And essentially, there are all these changes that are happening during perimenopause because instead of having these sort of regular hormone, um, cycles, they start to become more erratic. And that has a profound effect on the brain. It has an effect on our airway, our breathing during sleep. It also results in things like urinary frequency and having hot flashes. And so, what these hormones are really intended to do is to make that transition more stable instead of having like all this erratic changes. And then also the decrease is to try to stabilize that, kind of mimic the function before this process starts. And I think it's been, I think there are maybe 1/3 of people that you give them hormone, women, you give them menopause hormone therapy and they still have trouble have trouble sleeping. So there is definitely a multifactorial quality to it, but certainly that's something we want to check off, we want to ask about. And did your wife notice that her sleep improved?
A little bit, but not enough uh, to see a major difference. Um, she has noticed better sleep, but I think she was looking for a little bit more. But
Mhm.
I mean, it's not, there's so many other factors that play, right?
Exactly.
Play. Yeah, yeah, yeah. Do does is there a little bit of an issue too with finding the balance of your sleep and your prescribing meds? I feel like more is not always better, right? Do you find that there's some women that go down that route and maybe they're overprescribed or they're not, especially if they're trying to look at drastic changes? Because anything I feel that we put in our body, endogenously, there's a cost and there's a cost and a benefit and there's a give and take there.
Hmm. Sure. I think the pendulum is going to swing the other way. What I'm seeing in my office is I'm seeing women that might be too young and not really there yet, just exploring whether it's something that could help. And I think there are a lot of women who experience what your wife did, where they were hoping for this kind of magic bullet and it wasn't. I just, but and then there are people who just like, I had a patient recently who went on progesterone and she just gained a bunch of weight, so it's not always a pretty, you know, it's not always just this picture perfect thing that we see on social media, right?
Yeah. No, and we do mostly see the positives. People don't have a lot of the negative sides of it. Um, but it does show that females going into perimenopause and getting older in life, the effects of hormone and the sleep, right? I mean, sleep aids are all over the place. You go down the aisle, it's ZQuil, melatonin. It doesn't take, you can walk through a grocery store and you can tell we have a sleep problem.
Oh yeah, for sure.
Right? We have a sleep problem, and there's so many sides. I mean, I think I read a research of, I think it was teenagers, and sleep in teenagers is decreasing at a rapid rate, and then they started like correlating that to the increase in like ADHD and ADD and issues like that, or even like the breathing issues, oxygen during their sleep, sleep apnea, things like that, the effects on hormones. Um, I I find it really positive that there are doctors like you that are on social media, they're forming practices. Um, I got into it really for brain health,
Hmm.
right? Um, I tell people early on in my career in fitness, I always worried about physical health. The older I get, brain health is good. Like I do more and more for my brain,
Mhm.
really.
Yeah.
And sleep has made a big part of that. And I haven't made all the changes. I think three major changes in sleep, but I don't think I've had anybody who we've started coaching that when I ask them about sleep, they go, "Oh, sleep's great." Every
Never.
single person of them says, "I could probably do some things about sleep. It's pretty tough for me."
Mhm.
Hmm.
Can you tell people where they can find you? Like people watch this thing, they want more information about what you do. Do you work with people in practice? Do you work remote with people? Share some of that and where people can just watch this podcast and go search more about Meredith.
Sure. I'm very active on Instagram at Sleep Dr. Mare. I also have an in-person practice in the Seattle area. It's called SoundSleep Guru. And I also am licensed in Washington and California and can work with people through telehealth. And some people just reach out to me. They say, help me find a doctor in Texas, and I do. And so please reach out.
And I'm sure your content's super informative. Like another thing's like work.
Very. Mhm.
Ray said, your content's very informative about sleep. So we thank you very much for being in the sleep fight. This is a subject would have thought I would have focused my attention on sleep early in my career. Luckily, I've been around good enough people to tell me there's a problem, um, that I didn't sleep great. It is a hard thing to change, man. Like we've had people probably had bad sleep patterns since they were 12.
Mhm.
Hmm.
And then when you're 35, that's really hard, right? To do that. I have a 9-year-old and we don't do electronics in the room or not like that's a place we go to sleep.
Mhm.
Good.
So I try to do some good things around my kid and he'll have friends over and we'll put electronics up, but like normally that's not a place we go and we don't have the phone and we're not in there. That's your sleep place. So thank you, Meredith, very much for coming on and we'll share this content, get your social out, and we appreciate you coming on.
Yes,
Thank you
thank
so
you so
much.
much.
Thank you.